If there are no clear childhood symptoms, can you still diagnose and treat ADHD with stimulants? From a diagnostic point of view, DSM-5 and ICD-11 both define ADHD as a neurodevelopmental disorder. So symptoms should be present in childhood, even if they were unrecognized or mislabeled. So if a 35-year-old presents with, say, inattention, before I think adult-onset ADHD, which of course is a sort of debatable issue in itself, for us, the key aspect is how do we treat distress, thinking about the domains of perception, activity, cognition, emotional headaches, and sleep. So before jumping into a label, I'm looking for school reports that mention distractibility, disorganization, or often being a class clown, or had potential but did not apply it or did not implement it, strategies, etc. Early academic underperformance relative to ability, family recollection of restlessness, daydreaming, or being all over the place. But if there's genuinely no developmental history suggestive of ADHD, I'd be cautious about calling it ADHD and jumping straight to stimulants, because it would be difficult to justify. So here I think about mood, anxiety disorders. Sleep disorders are really high up here. Sleep breathing disorders, other sleep disorders, restless leg syndrome, etc. We also think about the environment, trauma, stresses, PTSD, and medical causes. Other medical causes are cognitive complaints, iron deficiency, anemia, thyroid dysfunction, etc. Legally, as we know in most jurisdictions, we're prescribing a Schedule 8 medication, in Australia Schedule 8, really connected to our diagnostic formulation. So therefore, we've got to think medical legally as well. The key medical legal issue is having a defensible, documented rationale. If we think about it this way, medications we use for ADHD are really powerful tools. They're indicated when we can show a developmental pattern of symptoms and impairment. And if the difficulty started later in life, our first task is to really work out why are they occurring now, which is where hierarchy and formulation come together, before we reach for stimulants. But the important thing here is that we can still improve cognition, activity, emotional headaches, the same dimensions involved in ADHD, through other medications that aren't stimulants, because the principle of dopaminergic, noradrenergic potentiation can occur through other pharmacological agents as well.